Pre-operative process for total knee replacement. Welcome to the patient education session on the pre-operative process for total knee replacement. Let's go over what you can expect on the morning of your surgery. Timing. Pre-operative, approximately 1 hour. Operating room, approximately 1.5 to 2.5 hours. Recovery department, approximately 1 to 1.5 hours. When you arrive at the facility on the day of your surgery, head to the surgery entrance. Please bring your insurance card and a form of identification such as your driver's license for registration. After registering, you'll be taken to the pre-op area. Here our healthcare team will get you ready for your surgery. The pre-operative process typically takes about 1 hour to complete. In the pre-operative area, the nurses will conduct an assessment, start an IV for medications and fluids, and may assist the anesthesiologist in administering a nerve block, if appropriate. Administering the nerve block. The nerve block is a local anesthetic that helps with pain control after the surgery. The anesthesiologist will administer a nerve block, if appropriate. Don't worry, you'll receive mild sedation so you won't feel any discomfort during this procedure. Marking the patient's knee joint. Your surgeon will also visit you in your pre-operative area to mark the knee joint that will undergo the total knee replacement. This ensures accuracy during the surgery. Once all preparations are complete, you'll be taken to the operating room for the surgery.